So in terms of the durability of the implants, I mean, how often does a woman need to get the implants changed? Is it longer with polyurethane implants, or is it quite consistent?
That's the big question.
Yeah, right.
You can ask that of any of the
Professor
implants
Fran?
data.
There's a number of little issues here. I was just taking up the way these things are made. I've actually had the privilege of seeing how they're made, and it's all done by hand. It's absolutely amazing. The testing is very, very thorough. But we do understand some of the physics about what happens with that gel. You can actually fracture it if your surgery is pretty incompetent and you're pretty heavy-handed. You can actually damage the way the implant is going to sit within the pocket. So I would emphasise the surgeon needs to have experience with polyurethane implants. You can't just use this and expect to get a great result. And to some extent that may be part of what's been going on, and that surgeons that get bad results give it a bad name. But for those of us that have used a lot of these implants, we know if you treat them in a certain way, they will behave well actually in the patient. Now, with regards longevity, we have to really look to two bits of data. One is the FDA report for 2011, which one would argue, I argue, isn't particularly a great report. It is looking at 8-year and 10-year data with two American products, not made in America but sold throughout America. That's the McGann and the Mentor implants, and their results are pretty, I would say, poor, in that the hardening rate of one of them is nearer 20%, it's 19.1%, and the other at 8 years is getting up to there, it's about 12.7 or something percent. So going hard is going to be in 1 in 5 odd patients, probably within 8 to 10 years. And that going hard then becomes symptomatic, then you're looking for change. And what you would be doing if you changed for one of those implants again, you'd be more or less doubling the chance of it going hard. So that's what's been going wrong over the last 20 years. We've been looking at complications of implants which we now know are not the right things to be using. With the polyurethane implants, you're talking about 15-year data now, which is showing a hardening rate of less than 1% and a reoperation rate of less than 2% at 15 years. So it becomes a no-brainer. The polyurethane has something in there which is making it a better performing implant. Now, with regards to longevity beyond that, nobody has data on polyurethane implants. But surprisingly, I did pick up some data from Brazil a few months ago that 50% of the McGann Mentor implants have ruptured in a silent way at 15 years. So 1 in 2 of those implants will have a silent rupture, which is non-symptomatic, not causing any problems. You just pick it up and you operate and you find that they have actually ruptured.